Our topic tonight is pain management in the 21st century. My guest this evening is Dr. Timothy Canty. Welcome. Glad you could make it with us. And for our audience, I'd like to give you a brief background so you know a little bit about Dr. Canty before we begin. Dr. Canty specializes in treating patients with back pain, neck pain, and other severe pain disorders. Dr. Canty is board certified by the American Board of Anesthesiologists in the area of pain management. Dr. Canty uses the most advanced techniques available to relieve spinal pains, such as that caused by arthritis, degenerative discs, spinal stenosis. Dr. Canty also treats patients with severe chronic pain due to nerve damage, traumatic injuries, reflex sympathetic dystrophy, and his practice reflects his strong expertise in treatment of resistant pain where previous therapies have been unsuccessful. Dr. Canty completed his interventional pain management fellowship training at the Beth Israel Hospital Medical Center in Boston, Massachusetts. Prior to that, he completed his residency in anesthesiology at the Massachusetts General Hospital in Boston. Now, in addition to the many articles and roles that Dr. Canty has played, we also want to say that in addition to his work within the United States, Dr. Canty has been part of many medical relief missions to Venezuela and El Salvador and Mexico, with groups such as Rotoplast International, performing surgical treatments on indigent children. And thank you. Thank you for coming, and tonight is going to be an eye-opener for our viewers tonight. And I'm going to start by saying the statement pain management. It seems like it would be very easy to define by the general public, but how does a physician define pain management?
Okay. Well, pain management is really a specialty of medicine that's devoted specifically to understanding, diagnosing, and treating a patient's pain, specifically the pain itself. Really what we take is a comprehensive approach to treating that pain and really coming at the pain from many different angles. So my role, specifically as the pain management physician, is to really kind of coordinate that care. And I have sort of a specific role where I do some of the treatments myself, but really what's important is to understand that there are many different facets of pain and many different ways to treat it, and to make sure that someone has the best, most comprehensive approach to treating that pain. So pain management as a specialty really involves trying to do more conservative and minimally invasive treatments to take care of someone's pain.
That's the way that it's headed today, the minimal invasion.
Right, exactly.
So I guess the other half of that question would be, or segue, is what role does the mind play in the healing process?
That's a really good question. So, part of the therapies, some of the therapies that we like to make sure that people are involved in when they come in to see me with pain, might be some physical therapy, some chiropractic therapy, medications, injections, which I perform. And really oftentimes getting someone involved with a pain psychologist or getting some support to help deal with the stress in their life of pain. Now, it's crucial to understand how strong the mind is and how much that can really affect your pain. And, making sure that you identify the people that may not have the support in their lives to really make sure that we can address that to help them cope with their pain. There are things like mind-body therapy and different types of treatments that you can do to help address that. But the mind is incredibly powerful, and it's more than half of dealing with pain, really. And as you talked about, some of the things that I treat, like RSD or CRPS, really all these neuropathies are problems where the nerves have become activated and they're just kind of firing off on their own, gone a little haywire. Yeah. We deal with cancer-related pain, and even if someone's been cured of cancer, they may have pain afterwards for quite some time.
Really?
We can help with that. And then, again, there might be pains after surgery that someone might have that persist even though there's really no problem anymore there. But, again, it has to do with the nerves kind of firing on their own. And, really, then they come and see a pain management specialist, and we try to pinpoint what the problem is and how we can get someone.
Right. So you're
pain-free.
really head to toe.
Yeah,
Yeah, right from the neck right down to the toes.
absolutely.